sepsis guideline, in trauma, crystalloid coming from 2 liter to 1 liter, the triad of death coming to diamond of death, then the whole blood transfusion getting split into component therapy and back into fresh whole blood transfusion, and then role of ionized calcium in bleeding patient in trauma. So have you ever thought that all these guidelines come from West and we just comply and carry our day-to-day work? I have not understood why this is happening. On the other spectrum, when I listen any lecture on YouTube by any expert, then he has probably 200 papers, 300 papers, but the health condition of our countryman or the country at large remain the same for the last like 30 or 40 years since the time I am doing practice. So I have failed to understand this paradox, but this is what I am going to talk today, and I believe this is my own opinion. Okay, I'm not doing any generalization, that it is primarily because of the lack of reflective practices. Yes. So what are reflective practices? So reflective practices is like whenever you do a skill or a procedure, then you pay intentional thinking and analyze that process or the procedure or the skill in order to perform it in a better manner in the future, so that your skill improves and your personal and professional growth ensue. So reflective practices I have been seeing is missing from Indian scenario. Now basically if you talk about the genesis of reflective practices, it's believed that the Greek king Marcus Aurelius, like in his Marcus Musing, he first described what are reflective practices. Okay, but I will not dwell into the ancient part of this reflective practices. My concern start, my relation start with the great educationist or the educator John Dewey, like who was there from 1859 to 1952, because I have read about John Dewey in the book Why Knowledge Matters, and there I read his thoughts. So from John Dewey to the main person, I think it's Donald Shawn. He's a German uh, person and who wrote a very important book, Reflective Practitioner. Okay, and there he described the reflection in action and reflection on action. So, but before that, I think we must remember other, prominent personality who have talked about reflective practices. So they are like the Gibbs reflective cycle, and the more important, like more than patent, I think the David Cobb, 1984, who gave us the experience learning cycle. Like in that cycle, there are 4 stages. So first you have a concrete experimentation, then you have reflective observation, then the third is some kind of abstract conceptualization, and the fourth is active experimentation. And then they, of course there are Terry Burton and the Ray Fromm, but important is like the Donald Shawn. Okay, so I have observed, and this is my lived experience, like whenever I go into conferences or workshop, that we rarely, apart from discussing our strength, like when there is a group discussion, we rarely discuss our weaknesses. So how we can do or practice these reflective practices? Okay, so first of all, whenever you do, like you can start journaling. Journaling means you can write down your thoughts. Please don't believe on your memory. Your memory can deceive you. Okay, sorry. So start writing your thoughts, your feeling, or your emotions, insight whenever you do a skill. Then only what is measured get improved. Okay, this is very important. And then you can have self-assessment, like the meta thinking. This is very important for our country, that we must reflect on our all experience we are having in clinical practice. Then peer feedback, mentorship. I will not go into the details because my concern is that why we are not innovating, why we are not, I mean, been able to solve our country's the millions health problem. What is lacking when we are writing so many papers? And of course, the debriefing, that is only is a conference. I would say event. It doesn't happen in day-to-day practice. And then mindfulness. So the mindfulness is like paying deliberate attention to what is going on. Okay, so these are the things you can read about it. By my concern is that these are the things by which you can do reflective practices. Now, reflective questions are also there. So in conferences, I generally hear only two questions, like what I did bad, what I did good. So there are no other things which are discussed. But here, very important is that what were you feeling when you were doing or learning the skill? Because I am telling you my own experience. Whenever I get a very sick patient, and I get very sickest of the sick patient, and I, although I say that you to take it as a challenge, but I get threatened, and my emotions get out of my mind and sometimes out of my hands. So that's what I realize, and I'm trying to control my emotions. So now I do sometime like be stressful. I do breathing practices. So this is very important. Like what were your emotions during the procedure or the skill or when you were managing the patient, and then what were the key challenges? Not only the challenges, even the success also. Like if you were very successful, then what were those factors? Okay, and then how can you incorporate these experiences or these whatever you felt for future learning? So these are very important points that we must reflect. These are the reflective questions you can always pose, and the important thing is the meta thinking. Okay, but now what are the various benefits? So whenever you have these reflective practices, of course it will lead to better decision making, better judgment, and better patient care. That's what we all want. Okay, it will enhance self awareness and increase empathy. Empathy is not only like you sympathize with the patients, but you understand other perspective, which is missing in India. Because whenever I have seen, there is a clone culture. So everybody go with the flow. Nobody raise questions like the way, like in India, nobody is going to challenge the XABCD of ATLS protocol. But we know that from 2 liter to 1 liter, and from component to whole blood, and from second intercourse space to the fifth intercourse space. So Americans, they are changing all the times. But it's not like you need a elaborated setup. Just invoke or just stimulate your thinking. Have reflective practices, and I'm sure you will be able to do something. Let's not go all the time with the algorithm guidelines, because they deadens your intuitive thinking, and we should not be doing all the times. Yes, whenever like there's a paucity of manpower or time constraint, then definitely guidelines and algorithm are welcome. Okay, so what are the other benefits? Like personal and professional growth. When you reflect more, you gain more, you learn more, and then better communication and collaboration. Again, this is a, I mean, lacking in India, because most of the time is indirect communication, and since there is no good communication, then there is no collaboration. I have seen, this is my lived experience. Like I try to talk to sometime retired person from institutes, and they generally go into, if you ask something, then guess what I'm thinking more. That's not the should not be the scenario, because they need to guide us, they need to mentor. Like they can be our mentor for reflective practices, or you can have a I mean the reflective practices buddy also. But the communication and collaboration, that's why there's not much collaboration. I am saying from the innovative point of view, why we are not able to have good collaboration, which has resulted into concrete you know uh, a change, I would say a tangible change. So now what are the barriers? What are the barriers? Barriers means like there's a time constraint. Our experts are very busy, who are very famous, who are very good at their work. They are very busy, they hardly take out time to reflect or teach reflective practices to our younger ones. The lack of motivation, like in any other field. And I'm not criticizing anybody, for God's sake, don't take it otherwise. And then fear of self criticism. You can suffer from imposter syndrome. I do. And then, because I said there's a clone culture, so there is a chance that you will be sidelined if you're thinking differently. The way, like, what will I be doing differently next time? So I have experienced that. Like, if you try to have a different point of view, like, once I was talking, rather I was texting to a MCH, you know, trauma surgeon, and I was just talking about the just culture. Like, just culture is like you can raise certain point without, endangering your interpersonal relationship, or without not having psychological safety. But she could not understand, and she got offended. So that's another problem. Like, you will be sidelined. So we need to have more communication, more collaboration, so that everybody understand what we are trying to achieve, what we are trying to do. Now, one thing why it is lacking, like according to Donald Sean is like he has described two kind of learning. There is a single loop learning, like, and the double loop learning. In single loop learning, like, you keep doing the same thing again and again. Like what Einstein said, like, you cannot get a different result by doing same thing again and again. So we need to change something. Like, we need to go for double loop learning. Okay. So now definitely the question arises, how can we overcome these barriers? How can we uh, motivate our younger ones to go for reflective practices? So this one can be like, instead of like just discussing in the conference or the workshop, it should be inculcated or incorporated into our day-to-day work culture. And use of technology. That's what I do. If I don't get any feedback or any, insight in my work, I usually put my work on social media. I am very thankful to, you know, although I have not met them personally, like James Ducanto, Hans Utinic, or Nilesh, or sometime, other fellow. They comment upon my work. They sometimes guide me. They tell me what to do. But in India, I've yet to see a community who is active on Twitter or social media and actively giving feedback. So that's missing, and must use digital platform to avail this opportunity. Okay, then have a growth mindset. Like, you must read that book by Carol Dweck, Growth Mindset. So what are the other things you should have when you have reflective practices? And then, seek feedback from multiple sources. Like, it has to be 360-degree. It is not only peer or your colleague who are like giving the feedback. You can have feedback from your nurses. So nurses usually India, they don't speak much. They don't actively engage in discussion, but I think they should be doing. And 360-degree means that you can have feedback sometime from the attendant also. Okay, so this is what I think that I should be talking about. And please make use of social media. You can, I mean, post your views, what ails India, what we need to do better or in a better manner. Like, one more thing, sometime I need to, talk about is basic assumption. Like, if somebody is from a premium institute and somebody is not from that well-known institute, so basic assumption is that everybody is a professional and they are having good knowledge. But at the same time, we need to have modern outlook. We need to reflect more. We need to indulge into reflective practices so that we can innovate more and we can have budget-friendly solution to our health problems, which is engulfing millions of our countrymen. Thank you very much.